and patients are very satisfied. So, any questions for me? And I'm going to bring Kelly up so that she can tell you a little bit more.
Okay, wonderful.
And I introduced her already.
Yes.
So I'm Kelly McKenna. I'm the lead provider for Fort Myers. So we opened in August, as they had mentioned. I think Cindy did a wonderful work. I feel like I don't have much to say at this point. We do have bags with the information in there to access our services, everything you've seen on the slide as far as what services we do provide. Also a little magnet that has the request number. We do see ages 3 months and up. So it is not just, so some people think, oh, it's just for somebody who's homebound. It's just for somebody that can't get out of the house or is a wheelchair, is home alone. We can see anybody. You know, for that mom that's got 3 kids that are all sick, she doesn't want to drag them and sit in urgent care or the primary's office for hours. You know, we come to them. It takes away the fear for the children too, so that they're not fearful of going to a facility. For our other patients, you know, it's much more convenient to sit on your couch than to sit in an ER for 6 hours and be uncomfortable. So we can bring all those services to you. This is an example of one of the cases we bring out. You can see that blue device there. That is where we can do an iStat. So we can check electrolytes, we can check kidney function, and so forth if IV fluids are needed. We can also, if there was a concern about a patient that we saw that they had some abnormalities, we corrected them with fluids, we can do a follow-up in 24, 48 hours just to make sure, recheck those labs, make sure that we're keeping them out of the emergency department and in their home setting. We come with certain medications, and then we have also modules in the back of the truck that if it was for laceration, ear, nose, and throat, so we have all different compartments. We can do urinary symptoms, all of those things. The one thing is that we can give initial IV fluid, IV antibiotics, but we can also coordinate services to have in the home with home health. That's where Cindy was differentiating ourselves, that we're the acute care. Just as if you saw me in the emergency department and I would coordinate services for you at home for the further management. So we can do that as well. Does anybody have any questions? Yes.
You talked about the impact on the emergency room and urgent care centers where you're going to those facilities. What about the impact on primary care physician offices, which have a big challenge on juggling their time available for urgent responses to their patients when they're calling in? Because
absolutely,
7:30 in the morning, you light up the phones,
and all the appointments are gone within the first 5 minutes.
Yes. And if you didn't get lucky on roulette, how do you deal with that? So what's been the impact on
So the primary cares, we've actually been partnering with them, and they've actually said, we can't see you today, but we can give you dispatch number and they can come out and see you. And then we coordinate back. We're not to take over the primary care. We would coordinate with that primary care to let them know. And as Cindy said, they can see it on my chart as far as the visit that we did, what our plan was, and sometimes I'm reaching out to the physicians to make sure I can coordinate care from them, the follow-up with primary care, maybe in a week when they can get in.
Another question. I know you're very early into this system and activity. You're less than a year into it, and you're seeing where you're now having frequency up to 500 visits a month, and each month has been progressively larger, I presume, as when you've looked at this.
Yes.
Where do you see the future?
Adding more cars.
Healthcare?
Adding more and more cars. We've got 6 in Orlando, we have 6 in Tampa, and we just keep growing. Our company has been around since 2013 and started in Denver, Colorado. We are now in 48 different markets around the United States. So we are growing, and we're growing our businesses as far as we're going to be adding mobile x-ray and ultrasound. Right now, we have to contract to other companies. We do not, the one thing we do not have is an x-ray machine in our car or an ultrasound in our car. So we have to, there is mobile, Trident is in the area, but they're so far behind that there is a need for it in the community, and hope to be bringing it to this market soon. And we just went from 2 cars to 3 cars, and they're talking about a 4th car soon. So, you know, the whole idea is to keep building so that we can service a larger area and be able to see that patient the same day or the very next morning.
So if I could just add into that, 1 second, if I could just add into that. I think dispatch health is one of our tools in our toolbox. Like I said, Lee Health is trying to be very disruptive in the market and keep up with the pace of healthcare as it's going. So other options include Lee Telehealth, and you can also schedule those visits through the, if you don't feel like you need to have a physical person come and see you, you can go on and quickly schedule a telehealth visit, and you can schedule that visit with a provider on the screen. And I think, that really, COVID was a game changer for healthcare. And so all of these different innovations were really necessary to see as many people that were so acutely ill so quickly. And that's something that's become more and more popular, and people are getting more and more comfortable with it. So lots of different options.
Yes.
So if my primary carrier is Millennium.
Yes.
What do I do?
That's okay. We partner with Lee Health, but we can see anybody in the community in the Lee County by calling that number.
And your provider will get discharge summaries. They'll
Yes.
be able to fax them.
Yeah, we fax them within 24 hours to the primary care.
Are you seen as competition to the hospital systems around here? And if so, what's their feeling working with you or against you?
They love us.
No, they're not in competition with us. We actually have a joint venture with them. We partnered with them to bring them into the community, yes.
It's a better cost savings for everybody, and really keeping the sick of the sick in the hospital and other people at home. The one thing we know from just looking at things, sometimes patients in the hospital can decondition and actually get worse. If we can intervene early, we prevent that. And we keep you at home, and we keep you healthy at home.
Just a segue from Jim's comment, how would you characterize physician support for the program?
Our physicians are very supportive of the program, as they are of the telehealth program. I mean, we are very well aware that and this is a national phenomenon, this is not a Lee County phenomenon, that there are not enough primary care providers
Right.
to see people right now.
And if I can tell a patient story, when we first started here, I had a Lee physician in primary care. They reached out to us to go and see a patient, and the patient kept calling in and saying all these complaints, and she was petrified to go anywhere. She says, I don't want to get COVID. This was right in the height in the fall, and she's like, I'm petrified. He says, I haven't seen her in 2 years. I need somebody to go out there, at least get her, figure out what's going on with her, because I can't figure that. We've done telehealth visits, but I'm not laying hands on her. Can you go out? Absolutely. We went out. We were able to then get on the phone with the primary care, talk everything between, set up a plan and everything else. Patient was extremely satisfied. The primary care says, you know what, this is a lovely woman, and I was so worried about her, and I'm just so glad that somebody was able to go out to, put hands on her and to be able to really evaluate her. And so we coordinate with those primary care. Yes.
Are you all nurse practitioners? Are you RNs? What are you?
Nurse practitioners and emergency.
Yeah, in the
Physician's
area.
assistants.
Yeah, we don't have any in Fort Myers physician assistants right now, and just for the mere fact that I just have so many nurse practitioners that have been joining the group, but we do hire PAs as well, and most of us are emergency medicine trained.
And how many are in the area that you hire or that you have?
I have right now 5 full-time and 3 part-time. And that runs 3 cars right now. So we run from 8 a.m. to 10 p.m. at night.
Every single day.
Every single day, 7 days a week, even the holidays.
Yeah.
So we're running, we run those hours. So like I said, if you called and it was 9 or 10 o'clock at night and we were at capacity, that they could push you to the morning visit as long as it was okay to wait.
What's your average response time from a call in?
It depends, because as Cindy described, that when they call in and if they have a certain complaint, so we have certain screenings. So if what we say is a green screen, meaning it's a simple, straightforward complaint, and they would check the insurance, do all that on the front end, and then assign that to the team, so we could see same day. They'll give you an estimated time of arrival. It's usually like a 2 to 3 hour window that will say, I always laugh, I said it's like the furniture delivery guys. They'll be there between 12 and 2.
What if it was like a laceration or something like that?
Right, so lacerations, they can wait up to 10 to 12 hours to be sutured, but you would be the same day. If you called in it later in the night and they knew that we didn't have capacity, they would probably refer you to the ER because you couldn't wait till the morning. But then you would get, when we have everything automated, when we're on our way to you, you'll get a call that says dispatch is on their way, your team is, approximately this, and then it will tell you to please put your pets and firearms away and have your insurance card and your identification ready for the team. So then you kind of anticipate that we're on our way. And I know that there is on the app, if you do on the web, you can actually see our little rover driving and follow us, and kind of like the FedEx guy too, to see where they are. So that's kind of neat. Everything's very automated, and we're moving towards too being able to scan your insurance card with your phone and your ID. So that's all done before we even get there. And sometimes you may even get a call for us just to go, if we're coming from Lehigh Acres to Estero, we might call you and say, hey, can we just go over through your medications while I'm on the ride, because it's going to take me 25, 30 minutes to get there. And then that visit is a little more condensed, and we can actually get to the physical exam versus doing all the other questions.
Now, what if somebody doesn't have insurance? Does
Then
it still count?
the self fee is $275, the self-pay, which is a lot less than an emergency department visit and comparable to the urgent care visit elsewhere. Yes.
Where are your mobile units garage? Is it one central place or?
Yeah, we're off of College Avenue. So we have an office there with all our supplies. So each morning we go and gather our equipment, our supplies, and stock the car.
Go ahead.
Just going back to your 275 and talking about all the companies that you're associated with, what happens if somebody calls and they come in and